We will talk about GERD or gastroesophageal reflux disease and what is the idea of the disease. We have gastric and we have gastric acid inside gastric, and if this gastric acid flows back towards esophagus, it is gastroesophageal reflux disease. And why it happens? It happens because of weakening gastroesophageal sphincter located between gastric and esophagus, and this sphincter is valve, and when this valve is weakened, gastric acid freely flows back into esophagus and sometimes into mouth also. You can see it is gastroesophageal sphincter. Now let's say what is the symptoms of GERD. First and most common symptom is heartburn. Person has burning sensation in his chest. Also, difficulty swallowing is important and common symptom, and chest pain. And regurgitation is also common. It means that person has feeling that content, fluids and foods from his gastric is coming towards his mouth. Is regurgitation and is common symptom. These symptoms are worsening during night time and after eating. During night time, because when person lies down, because of gravitational forces, this gastric content moves towards his mouth. That's why it worsens gastroesophageal reflux disease. And after eating also, because gastric is full and pressure in the gastric is increased and acids flows back into esophagus. If in rare cases, but it happens also, if this acid reaches to mouth, person has bitter taste, cough, hoarseness and enamel erosion of teeth also. So such cases also happens. It's not very common, but still possible. Now let's say what is the most common causes of GERD. First and most common cause is dysfunction of the lower esophageal sphincter, and we said about it already. Hiatal hernia is another cause, and obesity, pregnancy and consumption of alcohol, smoking and caffeine. What means hiatal hernia? Hiatal hernia and GERD are very related conditions, because hiatal hernia is most common cause of gastroesophageal reflux disease. So what means hiatal hernia? It means that part of gastric is bulged into chest cavity. You can see here and here. Normally gastric is located below the diaphragm, and during hiatal hernia part of gastric is bulged into diaphragm. You can see here also, this is diaphragm, this is chest cavity, it is abdominal cavity, and normally gastric should locate it here. And if part of gastric is inside chest cavity, it is already hiatal hernia. So hiatal hernia is closely related to GERD. It's very common cause of GERD. And when we have this bulge region of gastric, we have increased pressure in the gastric, and it weakens sphincter, gastroesophageal sphincter, and acid flows back into esophagus. That's the idea. Now let's say what causes hiatal hernia. Obesity is important risk factor, because during obesity we have increased intra-abdominal pressure. Physical strain is important risk factor, especially for athletes and people who exercise intensively or lifting weights. The abdominal pressure also is increased, and increased risk of hiatal hernia. Pregnancy is also important, and smoking. What is a complication of GERD and hiatal hernia? Sometimes hiatal hernia and GERD are nominated together and are used as a same disease, but it's not correct, of course, but sometimes it happens. What is the complications of GERD? Most important complication is Barrett's esophagus, and Barrett's esophagus means that we have metaplasia of cells. Instead of normal cells of esophagus, we have gastric cells and intestinal cells. It's metaplasia, and this metaplasia increases risk of cancer. That's why it's problem. So around 10% of people who have GERD, chronic GERD, will develop Barrett's esophagus, and Barrett's esophagus increases risk of cancer of esophagus more than 100 times. So Barrett's esophagus is serious condition, serious complication of GERD. That's why we should be careful. Also, complication can be esophagitis or inflammation of esophagus or ulcers of esophagus, but most important and most common risk factor is cancer, increased risk of cancer. Now let's say about diagnosis. Diagnosis is usually made by physical examination based on symptoms, based on endoscopy, manometry, which measures the strength of the sphincter. Bariums following X-ray is also very informative, especially in case of hiatal hernia. Measuring pH in esophagus is important also, but it requires time and it's not very practical, but it's more precise. Now let's say about treatment. For first step, you should avoid caffeine, chocolate, smoking, coffee, alcohol, and you should avoid foods which increases acidity. And what are the foods? Such foods are citrus foods, spicy foods, and acidic foods, caffeine, chocolate, alcohol. You should avoid them. And avoid large meals. Large meals also increases pressure into gastric, and it helps to flow back acid into esophagus. Part of treatment is using wedge pillow. You can see wedge pillow. It is wedge pillow, and it means that person's position is several inches above from horizontal position, and gravitation pulls these fluids down, not upper. That's why they are effective. From medication, antacids are used for short term, such as Maalox, for example. They are effective, but they are effective for several hours only. Second most commonly used medications are H2 blockers, such as ranitidine or famotidine. They can be used for several weeks, sometimes for several months. They decrease production of gastric acid. And proton pump inhibitors also are stronger compared to H2 blockers, such as omeprazole, lansoprazole, esomeprazole, and they are used at first 4 to 8 weeks, and after this according to effectiveness. But they have side effects. For example, they can cause dry mouth, so they have some side effects. That's why you should be careful if you use drugs. Generally, H2 blockers have less side effects because they are weaker also. Surgery in severe cases, try to avoid lying down for at least 3 hours after eating. It's very important. Sugar-free gums can help also, but they should not be mint flavored gums. You can eat alkaline foods like, for example, bananas, apples, and pear, and grapes, and melons, and watermelons. These foods are considered alkaline foods, and alkaline foods are also nuts, whole grains, and green vegetables. Ginger tea and chamomile tea also have effectiveness because they have anti-inflammatory action, and they can soothe gastrointestinal tract. They can be considered also as a home remedy teas. Baking soda is also effective for short-term treatment. A half teaspoon of baking soda in a glass of water and drink it is effective, but you should use them for short term because they can increase fluid retention in the body, and they can have also other side effects for long-term use, and long-term usage also is not studied well. That's why we have many question marks. That's why you should be careful with baking soda, but generally for short term they are useful and they are effective. Also, important part is sleeping on your left, because when you sleep left, your esophagus is above your gastric, so it's best position to sleep if person has GERD. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.